My name is Danae Barkey, and I'm an adult classical homocystinuria patient and the executive director of HCU Network America. I'd like to thank you for listening to our conversation today about HCU Network America's homocystinuria data collection, also referred to as the HCU DCP, powered by RareX. Today, our focus is on the digestive system. Our conversation around the HCU DCP all includes points that are both documented and undocumented in literature. We discuss both sides to help us further understand the patient experience. Our featured guest today is Gwen. Gwen, would you mind introducing yourself?
I'm Gwen. I live with classical homocystinuria. Diet, it's controlled by diet. I live in Ireland. I was diagnosed at 2.5 years when the lens of my eye subluxed. In relation to HCU, that's who I am, but it's not all of who I am. I also really enjoy photography and art and poetry and lots of other creative activities.
Wonderful. Can you talk a little bit, just because I know you and I were some of the older patients in our community, can you talk about why research is important to you and taking part in conversations like this?
Well, research is important in terms of anything in terms of generations to come behind us, that there may be things that may be seen to be related to HCU in the future that maybe haven't been recognized as yet, and the only way that these areas can possibly be looked at is through research. And yeah, so hopefully that links can be made through discussions like this, particularly today with digestive stuff.
Yes.
Makes sense.
I feel like this is one of those topics that we talk a lot about in our community, but because some of the taboo areas that get centered around it, we don't always feel comfortable talking to our doctors about it, the ones that actually can do something for us. So the first issue I have here on my listed topics around the digestive system is feeding issues, and these include things like just eating by mouth or keeping food in the mouth, or just there's a multitude of things that can really honestly fall into this area. Can you talk about some of the feeding issues that you have had?
I suppose if over the years there would have been times where I would have had difficulty taking my protein supplement drinks and keeping them down. And on and off over the years, I would have had a lot of reflux issues as well.
Yeah.
Specifically in terms of that area of the esophagus, or that area of the body, that's basically most of it there. Yeah, I did go through a period of 8 or 9 months as a teenager where I really struggled to keep protein drinks down at all, and that obviously had a lot of knock-on effects into my energy levels.
Yeah, it definitely, when you don't get it in, it definitely affects energy. But it's also one of those things, like if you physically can't get it down, what are you to do? I know for myself, I've definitely had bouts of that as an issue. And so it's sometimes a lot easier said than done. So did the issues start as a teenager, or is it just certain specific formulas that trigger it, or do you have reflux outside of Formula 2?
I have reflux outside of Formula 2. But to say, which is the chicken and which is the egg, it's hard to say which came first, given that I've been on formula since I was like 2.
Yeah, and I'm sure it's hard to remember.
Who knows? But yeah, it's not always straightforward to be able to pinpoint which is, HCU related and which isn't. I suppose something I found helpful in recent years is even like coconut based vegan yogurt, to have a bit of that before or after, definitely for me makes a difference, because it just kind of coats my esophagus.
Yeah.
And it makes a difference. It doesn't always work. Definitely didn't exist. It wasn't in existence when I was a teenager, whatever.
Yeah. That would have been nice to
Yeah.
have as an option.
Yeah. And yeah, it is just figuring out
Yeah.
what's available at the time and trying to work with it.
Yeah. I think one of the things I know with formula, because it definitely causes indigestion and reflux, at least in my experience too.
Yes.
But ironically, I still had issues prior to my diagnosis because I was a little bit older. I
Interesting.
was 10 when I was diagnosed. And I just remember like having so many trigger things that would upset up here and down. And it was awful. But it the one
but I suppose even in that respect, having issues prior to diagnosis doesn't mean that the diagnosis was there before it was picked up. So therefore, because I sometimes notice that, if I've, say, eaten bits of like ordinary bread because I've been out or I've been away or whatever, sometimes it's like I need to eat something, and the low protein product I need to eat isn't here right now. And even just, I use kind of bits of gluten-free stuff that's lower in protein these days. But sometimes then when I'm eating stuff that's, that is low protein, it can take a while for my digestive system to kind of flip back into, I can actually digest the stuff without any issues.
Yeah. Well, I think also we train our stomachs. Exactly. And if we're not used to eating something, like I know if I go and I take in not butter, because butter is not dairy in my world, but like if I try to eat, like have something with milk in it, it's just like, it's bad news for pretty much the rest of the day. And so, I think some of it is that too, is like we've gone without things. So
because like
reintroducing them can upset things.
Because I know I accidentally picked up a chicken vol au vent in my late teens, early 20s, when I hadn't eaten any meat, even in terms of counting it as protein exchanges or exchanges that I would have done up until like I was 12 or 13, because things were done differently then. It was a case of, if it's within the amount of protein you can have in the day, then you can have it, but then accidentally biting into something that was chicken, like I had reflux straight away before I even realized there was chicken in it. It's our bodies train themselves. Exactly.
It's hard to, like, that's where I'm like, is it really homocystinuria? Is it not? Is it medication? Is it not? Like, there's just so many factors. But so I'm going to move on here to kind of like the issues of stomach issues and constipation and dysmotility. I'll kind of like group them here together. So with the stomach issues, do they differ then from the other issues, like the reflux issues that we talked about?
Well, they do and they don't. And this ties into like another liver issue. While we're in there, we may as well just tie them all together, because there is a bit for me personally, there's a bit of a tie. At one point, because I had what turned out to be like a medium benign cyst in my liver, but it was pressing on my stomach, and therefore I couldn't keep anything down. So the two were connected. But it took 3 or 4 months to realize that was what was going on. And I also had gallbladder issues at the same time. So it's like there's a few different things there, but
I really think there should have been a gallbladder question in their list here of things with the digestive system, because I have also had my gallbladder removed. And I know quite a few patients that have. And
actually, I remember having this exact conversation 3 or 4 years ago in some group. So it may be something that comes out over time, and I can kind of see that it may have been an issue for a good while before, because it was a case of, they said basically that while they were in there removing that benign cyst off my liver, that they take my gallbladder while they were at it. And then when they took my gallbladder, it turned out that it was packed with stones, but that wasn't known 100% kind of before I had that operation.
Yeah. It's amazing, because when I had my gallbladder, I've had my gallbladder and my appendix out, so I don't remember which was which.
Haven't had my appendix out.
When I had my gallbladder removed, that's when they noted my liver was fatty too. So, and it wasn't just like a little bit fatty, but they said it was that of a person who was 200 pounds overweight, which that's significant. May have been like 15, 20 pounds overweight at, certain points in my life, but never 200 pounds. So it's like,
because at one point I was told, I can't remember whether it was from an ultrasound or whether it was from a blood test, I'm not really sure, that I was also told that I had a fatty liver that was like more than it should be, given, my general, health overall at the time. And it was like, I was basically told by a non-HCU related doctor that this was probably to do with HCU. But when I went and discussed it with my metabolic team, they basically were like, well, there's only been a tiny bit of research into this on rats, and like, there's nothing else known.
Well,
which was interestingly considering, the person that said that to me, or that came from like a surgical consult, but like it was a surgical consult with a team that were keeping an eye on me for a while after I had that liver cyst, or they weren't, and then they were again for whatever reasons. I've had digestive stuff on and off over the years, and it is just, that sometimes if something is, something is with a consultant or a registrar or whoever who HU isn't their area of expertise, but if they see something come up that doesn't make sense, they'll look it up. They might find one piece of research that doesn't, because research that's not based on people living with HCU.
Yes,
it's to do with HCU.
It's just general high homocysteine.
It's just like, who knows?
The one thing that I think is interesting, though, is like, we know that the liver does not metabolize things correctly. That's where the source of homocystinuria really exists. And they've done, actually, there's now been 3 cases where they've done liver transplants on patients. Usually it's because they're in such an acute state that it's their last choice, so they've been able to, they do the liver transplant, and then they have no more symptoms of, I wouldn't say symptoms, they're biochemical markers. So homocysteine and methionine normalize after, which is pretty crazy. Now, does it stop all the other stuff from happening? Only time would probably tell, but I wouldn't call it, it might look like a cure from the outside, but it also comes with a hefty price tag of like anti-rejection stuff too. I know that comes up once in a while too, because some other metabolic conditions, that's the standard. But with having that cyst removed from your liver and your gallbladder, did some of the stomach issues subside that you were facing, or do you still have pretty frequent?
They did seem they seem to subside kind of over the course of a year, but then I ended up with long-term chronic pain stuff in around near the site of somewhere that I'd had to drain from my stomach after surgery with it on my liver.
Mhm.
And yeah, I suppose then we can move further along the digestive tract as we're going. We may as well use
Yeah.
that at times that, yeah, I've definitely experienced some level of digestive issues, be that a bit of constipation here or there, but it's here or there. It's not consistent.
Mhm.
And yeah, so like, yeah, I know, I suppose with reflux, and I know I'm jumping up and down here and here,
No, that's
but like sometimes
and
it's
it
the
all
nature
is
of
so
it's the
interconnected. It's hard
yeah,
not to kind of go in like this kind of
loops,
loops. Yeah, because it all ends
because
up
it all
relating
connects.
so much back to each other.
Yeah.
That's the thing is like I have the opposite of constipation. And I know that was the case before my gallbladder, and it got better for a period of time, and
Yeah.
now it's a problem again. But it was interesting because when I was doing research and kind of ahead of time, there was a study, and Dr. Chapman, she has talked quite a bit about how inflammation affects our entire body due to
Yes.
homocystinuria. And I never thought about like, I think about it in terms of joints because that's like
Yes.
typically how we hear about inflammation. So
Yeah.
chronic pain definitely makes
Yeah.
sense in our community, but I
Yes.
didn't think about it in our internal organs and how inflammation could affect that. And so they were talking about how in mice with HCU
Yeah.
that they had intestinal inflammation. And so
Yes.
it's like if we have intestinal inflammation, of course we're going to have these other manifestations.
Exactly.
And so it's like, you know, I had never seen that suggested before, even though it makes complete sense. Now,
Exactly.
obviously, it's one paper,
Yeah.
but
But at the same time, a paper has to start somewhere.
yeah,
Research has to start
exactly.
somewhere. We can say, people can say it's one paper, but like, in relation to somebody having an idea to go and research, it
Hmm.
has to come from somewhere in the first place.
Yeah,
It has to come from nothing or a conversation with 2 or 3 people that sparks something.
yeah. And that was the thing is like until then, all I had to put with, the the inner
Inflammation.
workings of your lower body,
Yes.
um, your bowel movement habits. I guess I should put it
Yes,
that way.
exactly.
I had tied so much of that to the formula and to the low protein diet.
Yeah.
And I had never thought, oh, it could just be a cofactor of or a factor of having homocystinuria.
Yeah.
Because we definitely hear in other communities
But
that follow
also,
low protein diet how much it
but uh,
affects.
but also, like, I remember a nurse telling me when I'd been in hospital for something that ended up not being HC related, but I ended up seeing, because I happened to end up in hospital, the one hospital in the country that there's an
Mhm.
adult metabolic team based. Now, I wasn't their patient yet at the time because I was still with the kids' hospital,
Mhm.
but I ended up having really bad bloating towards the end of my time being in there, and somebody told me that it's something that they had seen in relation to, I think it was low methionine levels that they had seen,
Interesting.
a bloating, a presence of kind of bloating with that or whatever.
But it was with low
It
methionine.
was low,
So, okay.
which would have made sense considering I'd been in hospital for a week. So it obviously, not
Yeah.
been in control of very much in terms of, diet on a day-to-day basis.
Yeah.
But yeah, I'm pretty sure that was low. And it was maybe 6 or 7 years ago as well. So, but I am
Mhm.
pretty sure it was low.
Yeah.
Um, but yeah, like, because like even now, like I take a tablet for like bloating
Hmm.
for other reasons or whatever, and I still get bloating,
Yeah.
even taking that or whatever.
It's interesting, all the inner workings of it together. And
mm,
I think it's hard to look at things in
well,
isolation here because,
well, it's a whole. In the end of the day, like HCU affects like our whole bodies.
yeah.
It's not like it affects like our DNA. If it
Hmm.
affects our DNA, that's every cell in our body. So therefore, there's going
Yeah.
to be some level
Well,
of effect
I just look
or
at this and
defect.
I like, so my gallbladder started with, going back to that, it started with heartburn. It
Yeah,
started with heartburn when I was 12. And I just remember
yeah,
waking up in the night and I just felt like I didn't know how to describe it. And so not really understanding the low protein diet at that time because the diagnosis was still new to us. My
yeah,
aunt was like, go eat a piece of cheese, it will help with the heartburn. But it just continued and grew. It got so bad to the point where I couldn't actually keep any food down. It didn't
yeah,
matter what I ate, it was all going to come back up. And
yeah,
so it's, you think about that in terms of the esophagus. And then, but
mm,
it also affected my stomach too, because the gallbladder, it's just all so interrelated. And all the organs are
yeah.
so close
But even
together
just you,
too.
you talking about that, like in, I'd say from the time I was 10, 11-ish on, like I kept like a box of low protein milks at the end of the bed. And like I was forever waking up in the middle of the night, literally with such a dry throat that I needed to drink something.
Hmm.
And I was constantly drinking those things,
Yeah.
whenever I'd wake up with a thirst on me, just that's easy. Keep them there. And
Yeah.
then, yeah, I don't know.
It's, there's a lot of things. I sit here and I question my life, but like, is it HCU? Is it not?
Is it HCU? Is it
And
something
I,
else?
yeah,
But
I'm like,
but that would
at
have
least
also
if it
been
was HCU, I know what to blame. But it's
exactly.
like,
It's like I've given up blaming that because it's just like whatever,
but
you
that's
know.
also why it's so important to have conversations like this and, to
Yeah,
participate in what research opportunities are available because we're never going to get, I feel like we've concentrated on eyes, we've concentrated on bones. We
mm,
know it affects the cardiovascular system. We know it affects the brain, but it's like there's so many other parts of our body that it does affect that get completely missed.
yeah,
And so, until we speak and we you know, archive our experiences. Um,
exactly.
I don't think there's really much ground to do. So it's it's good to have conversations, even if,
It's essential.
our bowel habits embarrass us. They're
But to be
still,
honest with you see, for me, talking about bowel habits is a non-issue. I worked as a care worker for nearly 20 years. It's like
yeah,
whatever.
yeah,
It's like challenged me already when it comes to that conversation. It's just like
yeah.
there are
My
probably other
daughter
things
had
that
a book when she was potty training about how everyone poops.
mm,
And so it's just, it's one of those things I think we just have to like stop, you know, thinking about it in like this gross way. It's a more of a matter of fact thing, and we can
exactly.
address issues related to our digestive system if
Hmm.
we're too embarrassed to actually talk about them.
Yeah,
Because the truth is that so many patients that I've talked to are living with these issues, and they'll come to me in private.
yeah,
But it's like there's so many of us, and
yeah.
so
And
between the
like I
gallbladder
mean,
and
and just even that conversation, I've had it both ways with people, where
yeah,
people are experiencing it at both ends of the spectrum, but very not that many are not that many are kind of in the kind of in between space that most people who don't have HCU
yeah.
live with.
Well, I know we're about at time here.
We
I
probably
wanted to
are.
know, like, so if you could give advice to parents whose kids do have digestive system problems and who have homocystinuria, or just, general advice for parents of children or even adult patients with homocystinuria, because it's not just kids in our community. There's adults,
Exactly. We grow up.
clearly.
We're still here.
Yes. What advice would you give to them?
I suppose if you see anything you think is out of what would be your perception of ordinary, non-HCU, then
Mhm.
ask a question. because, you know, unless people ask questions, then research doesn't get done. Even the thing about what you were saying about being surprised that there isn't a question about gallbladders and stuff in here, that unless it's brought up, unless people mention it, then it doesn't become possible to be on researchers' kind of radar.
Mm-hmm.
And we could be sitting here in 10 years having the same conversation saying, but nobody seems to see that there's a link with gallbladders,
Yeah.
just to keep it simple.
Put it on my list to contact them and be like, which group is this under? Where does gallbladder fit into your scheme of things?
I'm not going to even make a stab at it because I'll get it wrong.
Yeah, I don't know. And so
Yeah.
it's like, but like we said, there's so many inner workings, and I think it's justifiable to ask your doctor questions and tell them what you're going through. And especially, I feel like your geneticist is one of those people that will have more answers.
Yeah, and also just in relation to, specifically in relation to difficulty keeping protein drinks down, keeping food down in general, talk early. It starts happening. It's happening even a week or two later. Ask questions. Don't leave it months.
Yes.
Because
it gets harder.
It gets harder. It gets harder to explain. It gets harder to kind of go, but I don't know where this actually started. I don't know how this actually started. It just is.
Yeah.
And I don't know how to, and it's much easier to start being able to pull apart kind of, a ball of knots a week or two in than kind of 6 months down the road.
Yeah.
I think ask questions sooner, like say something sooner, be it to your general family doctor, or be it to geneticist or metabolic consultant or whatever they are, whatever the label they come under, where you are.
Yeah.
Just say something sooner.
Yeah, I think that's a really important thing, because I think so many of us think, oh, it's just a phase, it will pass, and then it turns into longer. But you should never feel embarrassed if you're struggling with things, because they can't help you if you don't
ask for help. That includes kids that are weaning, whatever. And if there's something not going right, say something.
Yeah.
Just from talking to the parents of kids, say something.
Yes.
Don't be afraid to say this isn't working. There are extra challenges when it comes to, our bodies having HCU than the general thing. So don't feel like everyone is there trying to trip you up. They're not. They're, generally there to try and support you through the system, basically.
Yeah. It's overwhelming with little ones too. So it's like, take
and
advantage of the help.
Exactly.
They want to, and they're still cute and little. So doctors are even more inclined, in my opinion. Babies don't have attitudes like adults. So they're easier to work with in some aspects. So, well, Gwen, thank you so much for your time this morning. I appreciate it. So what we're encouraging people to do for the month of April is in the homocystinuria rare X data collection program. We are encouraging people to, if they have not created an account, you go to homocystinuria.rare-x.org, and then if they have not filled out the health and development survey, they'll need to do that first, and then most likely, based upon your answers, then the digestive system survey will pop up. So that's what we are encouraging patients, caregivers to complete in the month of April. And so if our listeners have not done that, we encourage them to. But I'm going to stop the recording, and thank you everyone who has listened in.